what I've been asked to do is to just share with you legislative updates in the Directorate Food Control. And just because I now have control, my screen is not moving. There we go. So in terms of the presentation, I thought as an overview, I'd give you the background and the context. For those of you who've heard me speak before, it might be old news, but I always like to sketch the background and the context of where we regulate from and how the system works so that people get an idea of what we are working with. Because to be quite honest, when I first joined food control, I could not understand what fitted, etc., etc. But I've since made peace with that, and I now understand it. I just talk a little bit about food control and COVID, and then we go into the nuts and bolts of the presentation, which is the legislative updates. And I thought, as a point of reference, we just go to 2018, and from then on, what we've updated in relation to regulations, and then the actual crux, which is on the horizon. What can you anticipate or what can you expect? So in terms of food control, the World Health Organization, which is the UN body on health, defines food control as what you see on the screen now. It's a mandatory, so obviously laws with enforcement either at the national or local authorities perspective to provide consumer protection and ensure that all foods during the entire value chain are what? Safe, wholesome, and fit for human consumption, conform to quality and safety requirements, and are honestly and accurately labeled as prescribed by law. So in totality, it's definitely a legislative issue. It's definitely an issue around ensuring that what consumers eat is for their good, both from a safety perspective as well as from a quality and from a nutritional point of view as well. And then it also speaks to issues around labeling and not misinforming the public so that they can actually make a firm decision around purchasing of a product. In terms of another definition from the World Health Organization, food safety is the assurance that food will not cause harm to the consumer when it is prepared and or eaten according to its intended use. So in terms of that, it firmly puts the mandate of food safety in terms of when the person consumes the food in the domain of the health department, and governments must ensure safe and nutritious food for all. In terms of another concept, which is food hygiene has been defined by the Codex Alimentarius, which is a joint standard setting body recognized by the WTO SPS agreement, and it's jointly been put together by the World Health Organization and the Food and Agricultural Organization of the UN. And it speaks to all the conditions and measures that are necessary to ensure the safety as well as suitability of food at all stages of the food chain. So often this has been misconstrued as food safety. And because I'm a regulator, for me, definitions make an important part in what I do and in what I understand in terms of conceptualizing things. Often people talk of food safety from farm to fork. Yes, one could look at it in that way, but for me, it's more food hygiene from farm to fork because it talks about all the conditions from all the stages of the food chain. Food safety, as I defined, is when it's ready to be eaten and prepared according to the intended use. So in terms of our policy environment and context, many people call our system a fragmented system because we have a multi-agency food control policy environment. We have three main role players in government because, as mentioned, food control is a regulatory activity. So there must be some form of government control in that. And we have three departments that look after specific categories of that food control system when you look at that definition of food control. And I'll start on the left, which is the Department of Agriculture, now Agriculture, Land Reform and Rural Development, but just for keeping things simple, I just put it as agriculture. In the main, they're responsible for food security, and ingrained in the definition of food security is nutrition and nutritious food, as well as ensuring it's safe. But their responsibility and mandate looks to both household food security as well as national food security. And in the main, South Africa is nationally food secure, but household food security still remains a major challenge. They're also responsible for what we call GAP, Good Agricultural Practices, which often is not necessarily regulated, but is something that must be looked at to ensure that at primary production level, those systems are put in place to ensure that food safety can be guaranteed or assured further on down the chain. They're also responsible for agricultural inputs, and these are mainly regulated through the Act 36 of 1947, your pesticides, your animal stock remedies, your fertilizers, your farm feeds, etc., etc. And then in the main, food quality is their domain. And then they have a mandate around veterinary public health, which is your abattoirs or your Meat Safety Act. The arm of enforcement is through national, provincial, and it's either through veterinary public health officers or inspectors, or in the case of the quality standards, through assignees. The one thing I must just mention also is you'll find a unit dealing with quality called Food Safety and Quality Assurance, and they're called Food Safety because they deal with the market access or export of some regulated agricultural products, and therefore that's why they've been termed food safety. I often say to Mr. Makafola, it should be export food safety, so that we're quite clear on the role that they play in relation to food safety. So that in a nutshell is agriculture. In terms of the Department of Trade, I forget what is their new name, Trade, Industry and Cooperation or something like that. I'm sure Billy, not Billy, Mr. Jacobs will clarify exactly his mother entity. But in the main, the Department of Trade and Industry is the department that has entities under it that deals with different aspects relating to food. The first is, as mentioned, the NRCS, and I don't want to steal their thunder because they are on the agenda to discuss. But what I just want to mention is that in terms of their portfolio that's been assigned or regulated by the Health Minister, because that is how the functionaries are assigned to the NRCS, is that canned meat, and I think that goes as far back as 1950s, as well as fish and seafood have been assigned to the NRCS to regulate and oversee in terms of those two industries. Purely, I'm not sure of the decisions made at that time, but there are, we've discovered regulations in place that relate to that. And then in the main, the Department of Trade and Industry also has the other mandate, which is called SQUAM, Safety, Quality, Accreditation and Metrology. And when we talk safety here, we're talking safety in general. So that's why you have the body like the SABS that will look at national standards for the safety of car seats, for the defining what should a baby's bottle be comprised of, etc., etc. Quality in relation to also some aspects that they would nationalize in terms of standards. Accreditation, you all know about laboratory accreditation, certification body accreditation, auditor competence, etc. And that's regulated through another entity under trade, which is SANAS. And then, of course, the SABS also takes international standards from the International Standardization Organization and converts them into South African national standards. Or it will take standards as requested from the industry and develop those standards, which are often voluntary, unless another piece of legislation has directly quoted them in the actual regulation, then they become mandatory. The enforcement of the NRCS is through the NRCS inspectors. And then you also have the Consumer Protection Act under trade, which is another entity, the National Consumer Commission, and they also have inspectors under them. Then we look at health, and that's the domain I'm supposed to be functioning within. And we deal in the main with food safety, food labeling, regulatory nutrition, surveillance in terms of foodborne illness. We also have a component of environmental health that deals with the broader aspects of coordination of enforcement of the Foodstuffs Act. We have nutrition, which deals with ensuring nutritious policies, obesity issues, etc. And then we have a component that looks at outbreak response, that is both the Communicable Disease Control and the National Institute of Communicable Disease. Both you would have heard of in the listeriosis outbreak, as well as now with the COVID outbreak as well. Our enforcement arm is through environmental health practitioners, either at national or at local government level. And then at the bottom, I've tried to put through to you the farm to fork principle and indicating that food hygiene and food safety must be a continuum along that food chain. I need to speed up a bit. I tend to speak a lot when I'm trying to explain things. This is just put in here for your information because I believe that the presentations will be shared or made available. That gives you in a nutshell what the Food Control Directorate deals with and how it actually links to health and economic consequences if food is contaminated. And on this part of this pamphlet, it talks about our roles and responsibilities, as well as referring to the original components of a food control system that the Food and Agricultural Organization developed quite some time ago. And then we put our roles and responsibilities in relation to where we overlap with other units. And there should be two others that are here that is under development in the new pamphlet. So in a nutshell, we administer, or the Directorate Food Control is responsible to administer the Foodstuffs, Cosmetics and Disinfectants Act on behalf of the Minister of Health, because he's the portfolio manager of the mandate of that act, and as well as administering the functions that are assigned to the Director General under that act. So it's an act that was originally assented to in 1972, but it has undergone amendments, especially to look at its constitutional veracity, and that was done in 2003 and finalized in 2009. It's also, in fact, the whole department underwent a whole legislative review through the Chapter 9 institution under the Law Commission. And they have also found that the Act has just a few outdated issues, particularly in relation to the inspectors under the old SABS Act, and that is something that needs to be amended. So in a nutshell, the Act is there to control the sale, manufacture, importation and export of foodstuffs, cosmetics and disinfectants. So the Act is supposed to cover all those aspects. As food control, we only look at the foodstuffs part. The imported foodstuffs is controlled by national now, a component that moves from provinces called Port Health. And in the foreseeable future, it might be moving to the Border Management Agency. I'm sure you've heard that being mentioned in regard to opening of our borders and COVID and all of that. The Border Management Agency Act has been assented to, and so I think as part of that, there was a proposal that all components dealing with any issue in relation to a port would be moved into the Border Management Agency. So the enforcement, as mentioned, is through the metro and district municipalities, and there are 52 of those. And in terms of the legislation at last count, and this was done by the previous director, there were approximately 50 sets of regulations, but I'm sure that has changed significantly because you will see later as I relate to that. In summary, it forbids the sale of any of those components that may be detrimental or harmful to health. It endeavors to protect the consumer from exploitation by false and misleading claims. and it attempts to provide the consumer with information to make informed, healthy choices. So if you relate that back to the definition of food control, you would see that the manner in which an act written in 1972 was done correlates quite closely to the definition of food control that has been established by the World Health Organization, even though the country was not a member of the UN at that stage. The philosophy of the Act: 1, it's reactive, meaning that the manufacturer, seller or importer must comply. We don't have a register of who is supposed to manufacture or who's supposed to sell in the country. It's a reactive act. It says anybody can manufacture something, but you are responsible to ensure that it's safe and it conforms to any regulation or any other issue, especially around safety. And that you can find in Article 2 of the Act. So the onus on compliance falls wholly and responsibly on the importer, manufacturer, or the seller. The law enforcer comes in to establish whether the product or the premises complies. So enforcement is, we'll meet you at some stage and we need to verify that what you are doing complies to either regulations or that there are no hazards that you are likely to pose a risk to human health. It also provides for the approval and stipulation of maximum levels of certain ingredients, additives to be used. So for example, you can look at food additives, the quality of ingredients, and it can have regulations related to compositional matters. Okay, the other aspect around the philosophy of the Act is that it's prohibitive. It has mention made of trademarks in relation to how a trademark can be displayed on a foodstuff. And although trademarks are also regulated under an Act under the DTI, the requirement from our side is that it must not cause any deception for the consumer. So we speak in Article 5 of false description, the nature, the origin, or the contents of a product. And I've put this picture in to show you how misleading that can be. The other aspect around the prohibitive philosophy of the Act is that nothing added or removed in a foodstuff unless it's permitted. So that implies that if you want to add something to a foodstuff, it must be regulated. So if an additive or colorant or a preservative that you want to be putting in, it must be regulated. So Sudan Red, we've had a couple of incidents with those. Fortunately, not yet any, although we're not looking, I suppose, but I can't speak to that. Maybe let me not say that because I don't have the evidence that we're not looking. But for example, Sudan Red is a colorant that's not allowed, but it has been found, I think, about 3 times in foodstuffs in the country. Where substances are allowed, they shall be non-injurious, present in minimum amounts, and comply to standards of composition, strength, purity, and quality. And then the minister can also declare any prohibitions in terms of the Act. So he does have latitude for that. The third philosophy is that it's prescriptive and restrictive in terms of defining how to put a label on a foodstuff, the format, where it should be, the size of the lettering. It also caters for exemptions, so the exemptions must be specifically regulated. It also allows for unavoidable presence of foreign substances, so for example, allergens, residues, melamine, and it then provides specific guidance and regulations around how those are to be dealt with. Then it also allows ministers to regulate standards for composition, strength, purity, and quality. We then also have standards for foodstuffs and containers as well as contact materials. So minister can regulate those. We've only done a lot around foodstuffs and containers, not so much on contact materials, specifically like you would find in the EU. However, there is references in regulations that deal with contact materials. Standards for premises, that's your one that I'll try to address as well. And then, of course, standards for persons, because persons are often the carriers of some of the communicable diseases that can affect food safety. So in a nutshell, regulations are published for food safety, either for foodstuffs, contacts, material, or the premises, nutritional composition and labeling, so information for decision making or not to be misled. And then the other regulations that we have is for health and nutrition, the wholesome outcomes from that definition of food control. So, for example, levels of trans fats, levels of sodium, fortification with micronutrients, and iodation of salt. So at the heart of it, legislation is in support of good health and nutrition and positive and optimum health outcomes, and that's why you find food control sitting in the Department of Health, because we're trying to ensure long and healthy lifestyle for all. Then in terms of food control and COVID, it's been business as usual in unusual circumstances, and I think we'll never forget that announcement in March last year. But what have we been doing? We did not shut down. We still continue to provide a service during the lockdown as well as thereafter. And in the main, we've been responding to queries, of which there's been lots, as well as communicating different aspects. We've also been communicating with other regulatory and enforcement authorities. The industry yourselves, we've had a number of webinars and just get a lot of queries from industry directly, and those go through to our technical experts. Consumers, we also get a lot of queries from them in relation to things that they've picked up at places they've eaten at. And then international bodies as well. We're the contact point for the WHO emergency, InfoSum emergency, and for the European Union Rapid Alert for safe food and feed, but no codex, because due to the lockdown, many of the codex meetings were, I don't want to say cancelled, they were postponed, and I'll talk more on that later. Also from the integrated management team, because there's been this query of the original origin of the source of COVID came from zoonotic thing. So surely food control needs to be there, and there needs to be looking at mitigating transmission, etc. And we clarify that in relation to the transmission is largely from person to person or from inhalation in a closed or crowded space. So the actual contact material of food has not been established to pose a risk of transmitting COVID at all. So that was one of the things we've been highly involved with. And then we're looking also at horizon scanning, which is normally a routine thing that is done by somebody, but we don't have those somebodies very necessarily always doing it. So, for example, looking at risk assessments rapidly, especially if there's a risk that has suddenly come up, looking at research. And then during this COVID period, we've also had 2 retirements. Those of you who know or worked with Ms. Marika Herbst, the manager for chemical safety, she retired in July of last year. And then we also had a senior administrative officer who some of you as FLAG might know, Mabel Sinclair, also retired in May of last year. So at the moment, and this point in time, since 2016, in total we have 4 vacancies in the directorate. So the legislative update since 2018. Biological safety, so in our component we have 3 subunits, and I call them units. Biological safety and program support deals largely with your microbiological issues, HACCP, hygiene, and all of those kinds of areas, as well as the program support in relation to offering training for law enforcers, IEC communication, engagement with consumer bodies, etc., etc. So in 2018, I'm sure you all remember the hygiene regulations were published after they'd been updated since the 2015 draft publication. And in a nutshell, that was what has changed. I'm not going to go into detail with that, except today to say that we brought in provisions of other regulations that have been floating about. So we had regulations in place from 1967, 1973, and we either brought those provisions in or we left them out depending on how critical they were in consultation marine foods with the NRCS. But those have also largely been brought in there, and so these have been repealed. Then what has also changed is Section 10. You now have the requirement for training of the person in charge. We have the requirement for recalls where you have to report to your local EHP as well as to the Directorate Food Control. Record keeping is now plus. It's not that record keeping was not there. And traceability is also now a requirement. The other issue is that the certificate of acceptability all had to be reissued or renewed as at, let's say, July 2019. So in essence, everybody should now have a certificate of acceptability that complies with the new regulations and is issued in terms of the regulations of 2018. We also clarified when the CRA need to be reissued or renewed because there were challenges around this in some of the enforcement entities. So that's the in summary. Also in 2018, we amended the HACCP regulations, Hazard Analysis and Critical Control Point Regulations Amendment 607 of 2018. And this is what we do when we want to make mandatory HACCP for certain sectors. And in that amendment, the listing was for meat and chicken processors, and that was largely in response to the listeriosis outbreak because that's where we found the source of the listeria that had been present and had caused the outbreak that we had. And with that listing, these processors must now have a mandatory HACCP system in place. And that became effective around March or April of 2019. Then in terms of chemical safety, we had the heavy metals regulations, which are now in line with the Codex specifications. And that's the regulation 588 of 2018. This unit also dealt with a number of repeals. So, for example, the old 1929 regulations that had certain provisions relating to composition, or they were outdated, those were repealed, but certain provisions have been retained. And one of these provisions is where the assigning of the function, I can't remember if it's the canned meat or if it's the fish and fisheries products that have been assigned to, in that situation, and I think it says the SABS. But as we know, the SABS has been overtaken by the NRCS in terms of the regulatory side, and so the NRCS by default then is responsible for that assignment of the regulations. They've also done a few repeals of other compositional regulations that fall under the Act, and so, for example, there's the edible fats regulations as well as the mayonnaise, and this was purely to try and as competent authorities say, okay, health will focus on food safety. Agriculture's domain is the quality, and although they've only done a few regulated products, they are doing some processed products already. So let's move over some of those that are really only looking at composition and quality. So those were repealed with that rationale in mind. Then we also have the Pesticide Regulations Amendment, and this is something we routinely do and should be being done on an annual basis because every time the Act 36 registers an active, there's a toxicological evaluation that is done, as well as a proposal around maximum residue levels for pesticides. And so on an annual basis, after we've done exposure assessments, we then update the legislation through an amendment. The last one was done in 2020, although it was started quite a while back in 2017. Then in regulatory nutrition, we've had the amendment or the correction notice in the reduction in sodium. Unfortunately, I don't have the notice number for that, and you can contact Mr. Matlala directly for that. Then what is happening on the horizon? What regulations are coming along? Biological safety and program support. This is where one of the vacant post of the vacancies exist. The manager for this unit is not in place. That's the post that I held before I became the director. And although we advertised, interviewed, unfortunately, we never completed the filling of the post due to a moratorium being placed on the filling of posts in the department, and that is still in existence. We are waiting with the new DG on what is the next steps once the new structure has been approved. So hopefully we can fill posts, although I'm told that Treasury is reducing the compensation, so I'm not too sure what's going to happen with our vacancies. We do hope that we're going to do some HACCP listing. Obviously, it will depend on the filling of this post. The ones that need to be thought about is the molds and processes, and this is in relation to chamber of baking, chamber of milling, the flours that are fortified. There was concern that perhaps this is not being fully audited or verified in relation to the fortification process, and so the proposal from the industry was perhaps it needs to be linked to an auditing function, and we suggested that through the HACCP process it could be added onto the HACCP plan, and then they could be listed for HACCP, and then the fortification process can then be part of the HACCP plan. So we're still awaiting for confirmation of this from the mills and processors, and that has been dealt with by our sister nutrition directorate because fortification sits squarely with them. There has been a query around whether we should be looking at milk as the next option for regulating, and that came long ago when they were looking at the national standard. I seem to remember a discussion that we had with the SANS working group that was dealing with it. However, we've not really explored it to the full extent. And as I said, because of the vacant post. Others, we'd like to bring them on board. So if any industry wants to volunteer, because the regulation specifies it must be 60% of the industry, or it becomes mandatory if it's related to a food safety incident. Now, we've only had one of those, which is the listeriosis, and I don't want to see any more of those, please. But I would like to see that we have this HACCP system being implemented in a lot more of the industry. Then the one that has been on the burner for quite a while, if you look at this, we started first with hygiene. Now we also need to look at the microbiological regulations. I think they are old as 1992. The challenge with them is that they are not aligned to Codex. There are levels for micro criteria in there that we have no idea where the science comes from. And if we are supposed to be aligning ourselves to the SPS agreement and basing our regulations on sound science as well as international standards, we need to be making sure that we review these regulations. That process started, I think it was around 2014. We had a working group put together, and the technical official has been working on that. But the caveat in this is, since the listeriosis outbreak, there has been a request for GEMRA to review the listeriosis levels. Not listeriosis, the levels of listeria in foodstuffs that have been put together. So we are awaiting that risk assessment, because remember, we as a country don't necessarily do risk assessment unless we have the means to do so. We are the risk management component of regulations. Then the milk regulations, the R1555, this speaks to standards and microbiological criteria specific for milk and dairy products. The industry had also put this on the list for us to be reviewing this. And I did say, because of the prioritization that we've done, the milk regulations, because there hasn't been much of a challenge around them, although there are concerns around some of the micro criteria being for quality as opposed to being for safety. But we had said the industry should be leading on this, and Mr. Jompie Burger in the DSA informed me last year that they are now gaining a bit of traction with regards to this. So hopefully we will see some sort of movement in relation to that regulation. Then we have our inspection regulations. These are regulations that it was the first set of regulations I encountered when I started in the department, 2006. They were already published as a draft and they're just been translated, and I just had to process the regulations for publication with legal services. There are some issues around interpretation in terms of what an inspector can do. So this was assigned to Mr. Tabete to look at how best to upgrade and amend this to make this more clearer. So that is also a process. Chemical safety, as I mentioned, the manager has just retired in the middle of last year. As I mentioned, pesticides amendment is often on the cards, and the technical official is busy with that at the moment. There has been a bit of a challenge because we found that certain toxicological assessments had not been done, although exposure assessments had already been confirmed on some of the actives that had been proposed from Act 36. And the question I've posed to the technical official, is it not time that we rather update this regulation and relook at how we do it so that we change it into a schedule type regulation, so that we can be more updating in relation to the actual format. There's also been a challenge around some of the codex MRLs or other exporting countries' MRLs are not considered. And she's also looking at how best we can incorporate that. Whether it will just be an amendment or a new regulation will need to await our legal interaction with our legal services. Then we've had the draft preservatives and antioxidants that has been on the table for quite a while. The technical officer was first initially looking at how do we deal with exposure assessments in relation to this. It was then discovered that because our food consumption data is very sketchy, it was last done in 2005 in relation to the food fortification. But the actual baseline or the real food consumption survey that we still refer to is the old 1999. There have been movements towards updating that food consumption survey, and unfortunately I did not get an update as to where we are. But the plan around this regulation is to link it to the Codex General Standard for Food Additives. But what I've said to the technical officer is, if we're going to do that, why don't we just do it for all additives, including colorants, preservative, miscellaneous additives, and make one set of regulations called an additives regulation. And we look how best we can cross-reference to the general standard for food additives, because that's how it was done for the sweeteners. And industry appreciated doing this. As regulators, we also appreciate doing this, because the minute the GSFA is updated on an annual basis, it then becomes automatically updated in our regulations. However, there is a query around whether this is significantly legal in terms of how we are supposed to actually regulate, in terms of having a set of levels in relation to how the Act is crafted. So that is still out for debate and discussion with our legal. But to put it all into one basket is what we would prefer. The challenge that the technical official said to me is that the colorants regulations needs a lot of engagement with industry. And due to the COVID and the situation with our building not being safe, that part of the process is a bit of a challenge. So that's the rationale around why this is still in a draft or working document process. Then in terms of the component that the actual manager was responsible for, which is the veterinary residues and stock remedies, this is a regulation of 1992. A draft was published in 2006 but never finalized. And what Ms. Hertz discovered, and what we discovered in terms of trying to update this regulation, is that the new Medical Medicines Regulatory Authority, SAHPRA, you've often also heard about them in relation to the vaccine and registration, etc. They are responsible for registering veterinary substances. And what we discovered was in that registration process, they have a database of what they've regulated, but they haven't indicated on their database whether the veterinary drug was registered for animal use in relation to, what do they call it, food producing species, because these veterinary substances could be used on frogs, it could be used on on pets, it could be used on any veterinary use, and so there's not been a distinction around whether it's for food producing animals or not, and that's only in the package insert. So Marika was working with them to try and look at how best to update their database, and I followed up a few weeks ago and they said it was definitely imminent and they were going to update the web page. The other aspect is the stock remedies. The stock remedies regulations or proposed regulations were also drafted because we're trying to get from Act 36 what has been actually registered in the interim, because since 1992 there has not been much record in our system on what has actually been regulated or registered with Act 36. So this process will only probably be resuscitated if and when the post of the chemical safety manager is opened up.
Penny, I'm sorry to interrupt you, but we really do need to wrap it up if you don't mind. Thank you.
Okay, I'll speed it up. Regulatory nutrition is Mr. Matlala. I've mentioned already the fortification regulations. There's also an amendment to the infant and young children regulations, but nutrition is also responsible for that. What is on the table at the moment is a draft regulation for foods for special medical or dietary purposes. So these are all your products that are utilized in dietetic environments. Sorry, now that I've been told to speed up, I'm losing track of what I'm supposed to be saying. And then we have the Boerewors regulations, which are supposed to be repealed in relation to that rationalization I spoke of with regards to agriculture, and that's been assigned to the chemical safety unit to deal with. The planned draft labeling regulations that were published, the plan was to take out the marketing to children and front of pack labeling and finalize a final labeling regulation, which included having this as mandatory. But due to an internal policy decision, we've now taken that we will rather revise the labeling regulations in totality to include FOP and marketing to children, because they are all interrelated to this, as well as the nutrient profiling model. So that work is what has kept this unit busy, and they should be finalizing a set of regulations shortly. Then the Food Legislation Advisory Group, or what we call FLAG, and I've been alerted to that people see this as a crisis because we last met in September of 2018. But this has been due largely to a number of operational issues, largely due to the fact that in September we had to quickly change the venue owing to the fact that our building had been mooted as being unsafe, and the Department of Labour at that stage closed it, I think, for 2 weeks, if I recall correctly. And so we've not had a FLAG meeting since then. The other rationale is that members of FLAG were asked for items for the agenda for upcoming meetings, owing to the fact that a number of issues regulatory were not going to be finalized, so we couldn't just have a meeting for the sake of discussing a schedule of legislation or anticipated legislation that had not moved on, and we needed to have more substantive issues being placed on the agenda. However, due to a lack of items for the agenda, that was the other reason we did not meet. Another aspect is that I've had an internal discussion with my principals on looking at what exactly do we mean by an advisory group, because when we talk in government, and you've heard about the ministerial advisory group for COVID and the vaccines and the public health messaging and all of that. So in governance, there's a specific connotation with regards to the concept of advisory. And should we be talking of an advisory group or an advocacy group? Because at this point in time, the meeting is not, or the body is not necessarily formalized as a typical advisory group to the minister, and yet the minister is responsible for regulating food safety in the country. So we are in process of trying to develop a proposal around how best we see this moving forward, and any inputs with regards to those that have a vested interest in FLAG or a vested interest in how to move this along are most welcome to provide us with those inputs. Other international, sorry, Linda?
Sorry, Penny, I'm really going to have to stop you there if you don't mind, because we are on a schedule. But we are looking forward to World Food Safety Day because it's coming up soon. And I'm going to hold your questions to the end if that's okay, because I really would like to come back to FLAG on your side. Do you have a last slide?
Yes. I wasn't going to go into that one if there was no more time. This is just about the food control webpage and the contact details. Due to the new minister and the new DG, we have had the department's webpage being upgraded or updated, which has made things a bit simpler because we now have a specific link to food control, but the actual content is still under construction, and we need to find where they've put our original regulations that were there. And so we're now looking at Plan B to try and resolve that. It's not just the regulations, it was all the information that was there. In the interim, the contact details, or if you're looking for regulations, you can contact me, because all officials are still functioning with limited email access. The building is still unsafe and has been fully declared so since the September flood. There is a move for us to move to a new building, and I have communicated to those stakeholders that I have contacts. But if you ever need to contact me, these are my contact details, and I will then refer you to the relevant technical official if you don't have their details. Or Mr. Matlala, who also has official cellular phone, can be contacted as well. So that, Linda, was my last slide. Thank you very much, and apologies.